Our qualified advocates amplify voices, views and wishes, and uphold rights and challenge breaches, and help people access services and navigate complex legal, medical, and social care processes. The pandemic has brought additional demands to our award-winning outstanding advocacy service. With no interruption, we adapted to provide remote services from home and risk assess where vulnerable service users experienced digital exclusion and required face-to-face visits. Remote advocacy works for some, but not all, and the right to privacy with an advocate was sometimes compromised or making safeguarding disclosures less likely. Referrals increased across all our services, both community-based projects and the statutory role we provide for people affected by the Mental Health Act, the Mental Capacity Act and the Care Act. The advocacy role is an integral part of this legislation, and our qualified advocates ensure people have access to challenge restrictions and decisions made on their behalf. We help vulnerable people to access the Court of Protection, mental health tribunals and safeguarding hearings to place the person at the centre of all decisions and services planned for them. Our research with national partners told us that 50% of advocates nationally were seeing people unlawfully locked in their rooms or sedated at the height of the COVID pandemic, or that some care homes were placing orders to not resuscitate all their residents irrespective of their health conditions. Our advocates carried out welfare checks to remind authorities to make decisions for those unable to make their own in a person-centred way and avoid blanket decisions across care homes and hospitals. Referrals to our hate crime advocacy service doubled in the pandemic, with a significant increase in people experiencing incidents of hate during lockdown, such as domestic abuse, neighbour disputes, and localised harassment, particularly race-related. Our project for vulnerable people who need support with health and social care issues now has a waiting list due to the volume of people wanting help. This is in direct relation to people seeking crisis services during the pandemic and where local authorities have reduced non-essential housing repairs, delayed care reviews, or buckled under the demand for community mental health provision. Families Through Crisis Partnership with the North East Law Centre and Changing Lives adapted this year to help more people in financial crisis as food banks and homeless support and welfare benefits appeals increased. We try never to turn people away and have provided many more bespoke contracts this year, focusing on those for child protection hearings. In a strategic role, we've worked with the sector to campaign for better advocacy provision and funding. We've responded to legislation change consultation, and we've created principles for the most effective advocacy, dispelled myths around advocacy provision, and we've engaged with local universities to research the need across communities we work with or those that we want to work with. Now more than ever, the advocacy sector has a key role in holding authorities to account, ensuring decision-making is lawful and engages the person, to fight for a quality of life for those who cannot speak up for themselves, and to ensure everyone has some choice and control within their own lives. We cannot reach everyone we want, nor can we be there 24/7 to help people think things through or access information. So we encourage people to self-advocate and offer support and training. This month, we launched our newly improved self-advocacy tool, the DIY Advocate app, and plan to roll this out across our service. We also invite organisations to use the app or to purchase a bespoke version to adapt to their own needs.